So we have done a couple of webinars and on topics that are, have been shared by members through the survey that we are conducting currently. And one was on, for example, on hospital-based HTA, and the other one was on digital technologies, which are very important to us in our low middle income countries, because in many places it is needed. The assessment needs to be done to inform decisions at the hospital level, but it's not being done. So more we do on that, and more we have, studies conducted at the hospital level, then we can, people get to know, there's this tool that can be used, and they can then use it. The different professionals, the CEOs of the hospitals, or the biomedical engineers. So that is one part. And then, of course, we are seeing that with the digital technologies, there is being a change in the way treatment is being provided at different levels of healthcare. So, and what effect or what impact is it having in our healthcare systems, and how it is changing the way the services are being provided, all the way to the primary care level, to the villages. So it needs to be looked into. There needs to be a legal framework for the use of these technologies, so that conversation needs to happen. And recently also, the team members, the steering committee members have done a workshop on HTA implementation, and that is also something that needs to be, discussed and shared between those that are already had the implementation and those that are upcoming. So it's knowledge transfer, it's transfer of experiences. So and facilitating that through the Developing Countries Interest Group is one of our mandates. Of course, it's, we have a big membership, 500 plus, and we try through our newsletters to engage with the members, have them give them a voice, and about what they're doing, sharing their work, sharing their experiences. For example, the scholarship recipients can talk about themselves. Also, we have opinion pieces. Members are welcome to write about, what is happening in their countries, what is relevant for them, or, for example, publications. And, one of our, the incoming co-chair, Yanga, she has done a summary about that. So these are some of the ways, providing a means, a way to showcase the work that is going on. Also, for example, I have, together with some colleagues, we have put out a call on adaptive HTA. If someone is doing studies on there, or there's interest, we welcome, your participation in the group doing that work. So this is one way of engaging. We would like to increase engagement with our members. So every time we ask them to reach out to us if they have any issues. Other way we are trying to engage is the survey, which is still open. We are taking inputs, responses, and more you respond to the survey, more you understand, what is needed. For example, capacity building, more projects, HTA implementation. That is the only way we can do this engagement virtually between the annual meetings. It's not always possible to attend the meetings in person, so that gives us an opportunity and we'd always welcome you that you be more active in the interest group, shape the interest group, and help also provide the means or the inputs that are needed for your purposes. So thank you for that.
Looking forward, we are seeing a lot of interest, a lot of developments in terms of the developing interest countries, participants wanting to understand more about HTA and how it can be implemented in developing countries. And we're also finding out that even though HTA has been around for a long time in developed countries, there's a recent increasing uptake in developing countries. So we see a gap where we still need to do a lot of work in terms of building capacity, in terms of building awareness and having people understand more about HTA and how it can be implemented, how it can be formalized in healthcare systems, as well as also understanding the challenges of developing countries' healthcare systems, in that some of the systems currently are pluralistic. They don't have one single health insurer, so it's dealing with or understanding what challenges they are facing and how we can work as a group with other HTA organizations or individuals to support these countries in formalizing HTA in their systems as they currently stand, or work towards seeing a future of how HTA could be implemented once they, let's say, achieve UHC at some point. And then we're also seeing a lot of trends in terms of the use of digital health products in developing countries, but frameworks in terms of evaluating them or valuing them for evidence, effectiveness, or cost, we don't have them yet. So they're also about working with those countries in supporting them, developing those frameworks and finding ways of how to value technologies for developing countries. How we plan to navigate the emerging trends is because of our group is so big, we are working on leveraging our patient, leveraging our population, leveraging the people that have joined the interest group, as well as looking at what other health systems are doing in terms of tackling the challenges in healthcare that are upcoming, as well as looking at in the healthcare systems what systems can we leverage on, what ongoing work or work that has been done that we can leverage on to support healthcare systems, to support the advancement of HTA in developing countries.